the nurse who just got convicted of the medical error, and they convicted her of. They were trying to convict her of reckless homicide, but she got a lesser charge than that. I think like negligent homicide or something.
In Tennessee,
like that.
right?
In Tennessee, she's facing up to like 8 years in prison for a medication error.
Wow.
She worked at one of the top hospitals in the country. A few years back, she made a medication error, and someone died. You just got fired from this job because of this medication error, which like med errors happen. They just do. I guess someone called the Department of Health on an anonymous tip. I think because the hospital was being sued for the death, that I don't know if it was someone from the hospital or somebody called the Department of Health to investigate it further. And the hospital basically said, it's not our fault. You're going to have to look at the nurse. And they came after the nurse and they brought her up on charges, and she wound up being found guilty.
Wow. I look at
from an anonymous tip.
I look at it from both sides, right? Now, the family of that person who died, what do you tell them, right? Now, I'm a healthcare worker. Like, I know what it's really like, right? I'm just talking about from the people who don't know what it's like, what we go through.
Yeah.
It don't matter how tired you was. Don't matter how many days you work. It don't matter if the hospital didn't do its job of providing us the right resources and the right staff. Somebody lost their life.
Yeah.
I understand it.
Yeah.
But what people don't mention in that article that I read in very detail, she worked numerous days in a row because they didn't have no staff.
They had a new system.
Had a new system of charting that she wasn't educated on properly. Why? Whose job is that? So is the negligence really on her, or is on this billion-dollar industry who was made to give us resources where we're constantly working at a disadvantage? And I said it is what it is.
Even pre-pandemic.
Pre-pandemic. So this is why COVID was so bad, because our healthcare system has been made where these CEOs and these execs can make no disrespect to your CEOs, billions. I've seen your penthouses. Billions of dollars. I don't want to disrespect their money. Billions of dollars for companies and banks and things like that. And we have constantly worked in a system where we have been given the bare minimum and trying to do the maximum. We have been playing God. And now when our country has finally hit a circumstance where we don't have the resources, we don't have the things we need to do it.
And they're recognizing that.
And now when so much patient overload, when so many things are happening, it's like, look how bad we look, which is inexcusable.
We've been trying to say for so long, like the healthcare system in general is stressed. We are worn thin. It is difficult to do our jobs well, to do our jobs at the safest way. We need help. We've been saying it for years, pre-pandemic. And now is when they're realizing, oh, wow, the healthcare system is really like genuinely stretched thin. Like they're having a difficult time.
And it's been like that for
but
a
it's
while,
been like that.
right?
We've been screaming it at the top of our lungs. And like, even now, like they're all they care about is money. They're trying to cap
and the only reason
salaries.
why I
Like,
know that aspect of what that's like, because she gets home, or even when she's at work and she's like, she'll text me. She's like, oh my God, honey, it is a fucking zoo here. It's like, and she's
rough.
like rough. And, she's complaining that she hasn't eaten. She hasn't used the bathroom because she's been so busy. She's taking care of more than, I don't know, the amount of babies or patients that she's supposed to have. And she's just like completely exhausted. And like, there'll be times where I just don't hear from her like the whole day. And she's, works 12 hours, right? And I don't hear from her the whole day. And then when I do, it's like very sporadic. It's like, hey, I'm just starting to eat right now. And it's like, she started at 7. And she just got her first meal at like 4:00 in the afternoon. It's like, it's ridiculous.
it happens, yeah.
Think about 2 weeks ago. You was waiting for me the whole time. Oh, we said we was going to eat lunch. I'm not even in the hospital. I'm picking up a baby from another hospital. It's
like, what? Jonathan, where are you? Like, you was gonna order food. Crazy. Like, you just disappeared. What happened?
I'm not eating today.
Oh, thanks for watching that video. Like, subscribe, hit the notification bell. You already know what it is. That food is amazing. But guess what? I want to make these videos amazing for you so that I can give you food and you can give me food and we can have a big food sharing circle, All right. See you later.